Good afternoon. Welcome to day 415 at the EMA office. I'm joined here today with Mila from the Health Department and Chairman Kern. Mila, thank you for joining us today, and you have the updated numbers.
I do. Thanks, Herb. So today, for Sunday, May the 2nd, we have 20 new positive tests out of a total of 765 for the day. The age range of those individuals was under 10 to in their 70s. The county positivity rate is at 2.6% with a 7-day rolling average at 3.2%. The regional positivity as of April the 29th was at 2.5%. And fortunately, we have 0 new deaths to report today. Countywide, we've conducted a total of 342,955 tests, consisting of 30,515 positives and 312,440 negatives. Total number of deaths to date is 476. Our condolences go out to those families. To date, the number of individuals who've completed their 10-day isolation period is at 29,740. Statewide, we've tested a total of 22,822,562. Total positive was 1,339,728, and that's an increase of 1,860 from yesterday. Total deaths today is 22,019, and that's an increase of 27 from yesterday. For St. Clair County hospitalization numbers, we have 25 COVID hospitalized patients within the county and 38 regionally. Another good thing to note today is that we have 0 number of individuals who are on ventilators both in the county and regionally. So that's one of our highlights. And for those congregate care facilities that are in outbreak status, we have no new updates for today. We continue to offer testing at St. Clair Square Monday, Wednesday, Friday, and Saturday from 8 to 4, as well as MedExpress, CVS, and Walgreens. Chairman Kern?
Great, thanks, Mila. Okay, let's look at the zip code report for today. 62201 up 1 to 605. 62204 up 2 to 420. 62206 up 3 to 1,399. 62207 up 4 today to 625. 62208 up 1 to 1,723. 62220 up 2 to 2,178. 62221 goes down 1 to 2,920. 62226 up 3 to 3,348. 62232 up 1 to 937. 62239 up 1 to 498. 62260 up 1 to 837, and 62269 up 4 to 3,416. 20 new COVID positive diagnoses today in the county. 765 tested, brings our county positivity up to 2.6%, but the rolling average does go down today to 3.2%. Regional positivity is also down to 2.5%. because Bond County called in at 0.6% today, Clinton County 2.2%, Madison 3.6%, Monroe 1.1%, Randolph is at 0.7%, St. Clair 2.7%, and Washington County calls in at a low 0 today. Herb, question and answer day.
Question and answer, just a few come in today, and Brian, why don't you go ahead and start them off with Mila?
Yes, sir. So, Milo, the first question that came in today says, lately I've noticed pharmacies advertising at-home COVID tests. How are these tests administered, and how are their results reported to the health department?
So there's some that are out there at the pharmacy that you would pick up and do at home, and those are not reported. However, Illinois Department of Public Health has an IDPH self-testing page on their website that you can look at those directions. And there are some tests out there that you can have proctored by your physician or your healthcare provider, and then that healthcare provider then reports those statistics to the state. So you just have to be careful on what type of test that you're purchasing and look into that information. I would encourage you to go out to Illinois Department of Public Health website before purchasing one, if that's what you're looking for.
Okay, thank you. The next question says, how many people are going through the mass vaccination site now at the fairgrounds? Has it slowed down?
It has slowed down overall. Our top numbers were around 2,700 per day, and so now we're down probably under 1,000 per day, and we're seeing that across the state and throughout the United States as well. They've seen an overall decrease.
But Mila, I think people need to realize that we're going to be closing that site the end of May.
Correct.
May 30th. So if they want to take advantage of the convenience that is offered there, and they'll need to get in there now, especially with the 2-dose shot. They've got to make sure they have time for that 3 weeks in between to get their second shot, also at the fairgrounds.
Right. So we are running predominantly Pfizer, so there's a 3-week turnaround, 21 days between your first and second dose. So please plan accordingly. After that site closes, we will still offer vaccine at our 330 West Main location, but we want to get as many people through the MassVac site. It's typically less than a 30-minute wait. We're there from 8 to 6:30 daily. You can come without appointment from 9 to 5. We really encourage everybody to get out. It's an efficient process. You can bring the kids with you. I was talking to someone the other day, said, well, I've got my little ones with me. Give them a coloring book in the back seat, and they won't even know what they've been through. It's pretty quick. You're in and out, and so it's right there. It's a great resource for the community to take advantage of while it's still here.
Very good.
All right, Milo, one more question that came in. Says, if you are fully vaccinated, why do we have to mask up and social distance? At what point will we all be safe?
We have a lot of people who are in transition with their vaccine, so maybe they've received one dose and not the second dose, so they'd be at about a 50% with both doses, a lot of them around 95% effective. And we do have variants in the community, so you want to make sure that you're safe. There are guidelines out there that if you're fully vaccinated, you can be with other fully vaccinated people without wearing a mask. There's a sheet out there, we've got it on our website, that shows you the different things that you can partake in once you're fully vaccinated. So I encourage you to look at that information. But again, there's always a risk, a chance, and we want to make sure that everybody's safe and healthy.
Okay, and the final question that came in says, what is St. Clair County's plan to address the vaccine hesitancy in the younger population? 75% of the positive cases yesterday were under the age of 40. This seems to be the age group that is causing this to go on much longer than it should. What can we do to encourage them to be part of the solution? Thanks for all you do.
Thank you for that. So we know that for individuals under 16 that we don't have an approved vaccine, and I think that's one big step in the right direction. I know they're looking at EUAs to allow some of those vaccines to be approved for the younger age groups. In the meantime, we have done targeted messaging with our high school students, our seniors who are going to get ready to graduate. They're having proms and get-togethers. We'll be dispersing, throughout the state and the country as they go off to college. We've had a dedicated day for college seniors or college students and high school seniors. And then we're working with some of the local high schools to go on site to offer vaccine there as well. And IDPH now has a mobile clinic that's out and about, so we can try to target some people in our outlying areas. But again, we have a great resource here in the county with the MassVac site, and it's quick and efficient.
So go through, what is the an EUA?
Okay, it's the emergency youth authorization so that the vaccine can be used for COVID. So you saw that was approved for Pfizer, Johnson & Johnson, and Moderna for the population we have right now. So Johnson & Johnson and Moderna are approved for those individuals who are 18 and older, and Pfizer is 16 and older. So there are some looking at the younger age groups for all three of those vaccines, and the 12 to 15-year-olds specifically for the Pfizer.
So, and that is an approval that has to happen on the federal level
Right.
by the CDC?
Right, and ACIP. So there are different, and they should be meeting fairly soon to look at those authorizations and approval. And again, we won't know until it's gone through that process, but we hope to look, as late as the fall for the younger, the 12 to 15 age group, and then maybe next January, February for the younger kids as well.
Well, Mylan, I think one of the things that we keep seeing is every day our positive tests to come back, over half of them are the age group of under 40. And I think that's the group that we have to reach out to. And we've asked people to make suggestions to us. How do we get that 40 and age group under from that 40 to 16 to understand that they're not invincible, that this virus is serious. And, today I think there was out of the ones was tested, 12 of them were under the age of 40.
Right.
So that's the group that we got to try to get the word out there to them, but I don't know how to do that.
Well, they're the working age group predominantly. So, and we are open to 6:30 out at the fairgrounds, and we're open 6 days a week. The only day that we're closed is Wednesday, so you can come on the weekend, you can come in the evenings. We open at 8. That 8 to 9 is typically our busiest hour, so depending on what time of day your day starts, you can come out to the fairgrounds.
And you're open past 6:30, it's just your last appointment is at 6:30?
Correct.
So then it takes a half hour to get people through, and then you have to break down.
Right.
And I think we're still seeing the hesitancy on that age group of not wanting to get the vaccine. for whatever reason. They're not sure. They're waiting to see what the side effects are. But as we've talked about the last couple of days on here, the benefit outweighs the side effects that we've seen actually. So
Yes.
we encourage everybody to get.
And you have two
get-
people today that were in their 70s that contracted COVID. Now, they've been able to get this vaccine now for months. So some people, it appears, just are not going to get it no matter what we do. But we really encourage everyone. The only way we get through this and open up like we want to is for everyone to get vaccinated and for everyone to continue for a while to keep wearing your masks, washing your hands, and watching your social distance.
Yep. And vaccine is the best tool we have in our tool belt at this time.
Exactly, right. Brian, what else you have?
Chairman, one question came in for you, says 0 people on vents, hospitalizations at all-time lows. Isn't it time for St. Clair County to advocate opening us up?
So, and good job, Team St. Clair. All those statistics are all accurate. The state is looking at things statewide now, and they're looking at the numbers, checking where there are hotspots. We fully expect that we will be moving into a fully open level very soon. I know the country, they want to open by July 4th. I would fully expect that Illinois would be ahead of that, since Illinois really has been ahead of most states and on their vaccinations. And St. Clair County has been ahead on our vaccinations. So all our numbers are great. We are leading, and we continue to advocate for opening up. But at this time, it appears that everyone wants to make sure that when we open up fully, which really the only thing that's left are concerts and major venues where people are kind of packed in. You're going to have to continue to wear a mask at those, I think, anyway. But when that opens up, we fully expect that should happen sometime this summer. We just need to continue to be careful. The summertime is our friend when it comes to this virus. We've always known that those summer months are the best months we have. The virus does not translate well in the community, or isn't able to be spread very well in those summertime months, which is why last summer some of our lowest numbers really occurred during those summer months. We expect that it's going to translate even better this summer, given the fact that we've got our rates down as low as they are. We are working on getting this virus licked, and so I would expect that things are going to open up. But for now, we're going to stick with the state. The governor, as always, is listening to the doctors, to the scientists from Illinois Department of Public Health that are making those recommendations. So until then, that we get another recommendation, we're going to stick with the state and continue the way we are. But we've all been out in local restaurants. We've all been out doing much of what we did before day 415. On day one, we think that this is all going to come back. So.
Well, I think, as we say quite often, the numbers, you can't argue with them. They are showing we're heading in the right direction, as we've been saying now on day 415. But we got to continue. The last thing we want to do is let our foot up, and then we go backwards.
You got 7 more people in the hospital
over 24 hours.
In 24 hours in St. Clair County. So it's still there. The chances of getting it are still there. Let's not, as Herb says, take our foot off the gas. Let's get this thing to where we're able to report on single-digit COVID positives. That's the day we're looking for.
And as we say every day, there's nobody than Team St. Clair and us sitting here at this table every day at 3:30 that for 415 days have been bringing this information to you to once it's over with. We want it over with. We want to move on, believe me, but it's our job, it's our responsibility to keep you, the citizens, updated, and that's what we've committed to do now for 415 days, and we will continue to do that. The Mass site will close on the 30th of this month, so you need to take advantage of that. You heard Mila say get your first shot if you haven't got it, and then you got to wait that 3 weeks. So, you'll still be able to get it at the 330 West Main, but now it's so easy, it's so convenient. Please take advantage of the fairgrounds site and help be part of that solution. We'll be back with Cindy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 416. Everybody have a good evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.